Hi, my name is Emma Snyder, and I am a student in Reverend Naomi Washington Leaphart's Theology class. And I'm here to talk to you about something in the class that really stuck with me. So I'm going to discuss the topic of faith, reason, and culture in relation to medicine. So in order to do this, I'm first going to define those terms so we can get a better understanding of how they relate to medicine. So faith is a strong belief in God or in the doctrines of a religion based on spiritual apprehension rather than proof. Reason is the power of the mind to think, understand, and form judgments by process of logic. Culture is made up of customary beliefs, social forms, and material traits of racial, religious, or social groups. And/or it is the characteristic features of everyday existence shared by a people in a certain place or time. So, in the beginning of the class, we watched a documentary on Netflix called Extremists. And in this documentary, it basically shows the same thing they're in the hospital in the ICU, and these patients are on life support, and it shows the decision-making process from the view of the doctors and the patients and the families. So in the ICU, medicine is really the only thing keeping these people alive, which means that choices need to be made about furthering their care. And these decisions can be influenced by faith, reason, and culture. So faith influences this because, well, first you need to understand that faith isn't certainty. Like, just because you have faith in something doesn't mean you're 100% sure about what's going to happen. So it can coexist with doubt. So that's shown in this film because the patients' families want to have faith that a miracle will happen, but obviously when their family member is on life support, there's going to be some doubt in their mind because it's not the best situation. So this is shown by the daughter of the patient, Selena, Selena stopped breathing on the way to the ER and suffered severe brain damage. But her daughter, Selena, performed CPR on the way to the hospital. So she believes it's a miracle that her mother even made it there. And so she's hoping for another miracle, and that's what she tells the doctor. And we also see faith in Selena's brothers. Selena's brothers have a discussion with the doctor, and I'm going to read you some quotes of what they said. So one brother said, "God has proven to me miracles are miracles, and we're asking him for one." Another brother says, "Take me off, and if I breathe on my own, then that's fine. That's God's will. If I don't breathe on my own, then that's fine. Then that's God's will." So you can see that this family obviously has faith, has a relationship with God, and it's like a difficult situation because you want to believe that God is doing what's right. So like the one brother said, whatever God's will is will happen, but in order to do that, you'd have to take Selena off life support first. And if she breathes on her own, then it's a miracle, and that's what God wants. But if not, then they have to accept that her life is just taking its course. So in this film, faith isn't just shown as faith in God. There's also faith in family. One of the patients, Donna, she wants to be taken off because she's suffering, but she's like scared of what will happen when she's gone. And I think it's her husband, maybe, or her brother, but he is reassuring her that he's telling her to trust him, trust that when she's gone, he'll take care of her daughter. So she's having faith that it'll all be okay when she's gone, which is a really important thing, I think, in these situations. So reason. So in this short film, they address the fact that everyone's going to die someday. But the discussion they're having here is having a say in how. So it's the doctor's responsibility in these situations to give reason and acknowledge the facts of these people's situations, and sometimes you need to be a little blunt. But in these situations, when the doctor is explaining the situation, patients' families constantly ask questions to be sure they understand what's going on. They want to know that if they withdraw life support, that everything has been done. Everything possible has been done. They want to know if there's a definitive test to be sure that they will never recover, like that this is it, and that it's better to take them off. So doctors need to find the line between extending these patients' life without causing more unnecessary suffering. So when Selena's daughter was talking with the doctor, she made the point that being a doctor with all this knowledge, all this reason, all these facts can maybe dwindle the optimism that these doctors have for their patients' recovery. Another thing that influences these decisions is culture. So Selena, we mentioned that Selena's family drove her to the hospital, and this is because Selena did not want to pay the $2,000 for the ambulance because she was in financial struggles. And so you can see how culture affects one's experience with medicine, because if Selena maybe had gone earlier, had called the ambulance, she wouldn't have been in this situation where she was without oxygen for an amount of time and caused this brain damage. So her culture influenced that. Also, there's another patient. He was a homeless man who was institutionalized for much of his life, and the doctors have a hard time determining what to do in terms of his care because he's no family to ask, and you can't base his decisions off what he wants because of his mental state. But without a family surrounding him, it's even harder. So this leads me into a discussion on faith-based providers in medicine. We read an article in our class called In a Weak State by John O'Brien, in which he discusses when faith-based providers and women's needs clash. He says that some faith-based providers use conservative interpretations of the Bible to deny access to critical cares. An example of this is the case of Tamisha Memes. Memes was 18 weeks pregnant when her water broke. So she visited Mercy Health Partners, a Catholic hospital in her home state of Michigan. So this was the closest hospital to her, so this is where she went. She was in serious pain, but the hospital sent her home. She returned, they sent her home again, but the hospital insisted it could do nothing to help her until she went into labor. So when she did, she came, and the hospital's claim was that there was nothing they could do for her because it was a Catholic institution and they couldn't terminate the pregnancy even though it was causing harm to the mother, and the mother could have potentially died. She was never told, the hospital never explained this to her. They never told her that the reason they couldn't help her when she arrived in pain, bleeding, and possibly developing an infection, they didn't tell her that it was because of ethical directives that the hospital had. Nor was she told, redirected to a non-Catholic hospital that could help her. So Means ended up surviving, but her baby died soon after delivery. And Tamisha could have very well died along with her baby of infection. She's very lucky that she didn't. So this isn't the only case of this happening. In Ireland, a woman who was 17 weeks pregnant went to the hospital in extreme pain, but even though they knew that she was miscarriaging, they didn't do anything until the fetus had died, and shortly after the mother died of infection. In the Dominican Republic, a pregnant teenager with cancer was denied treatment because it would likely terminate her pregnancy. Again, both the mother and the child died. In Phoenix, in 2009, St. Joseph Hospital did approve an abortion in order to save the life of the mother, and soon after this, the local bishop stripped the hospital of its Catholic identity. So this really raises questions about where do we draw the line between faith and medicine. So we can see in these situations that this blind faith, this faith that God would want us to save the life, one life over two, is just, it's a fine line. And here faith is interfering with reason, because it's reasonable to try and save the baby, but also while trying to preserve the life of the mother. And it's reasonable to inform the mother of her situation, but they're not doing these things because of their faith and because of their standards. So I just think that everyone needs to start thinking about this and think about what can be done. And I think that we need to think about the ethics of these hospitals that don't make their Catholic identity clear and to their patients. So yeah, just think about that. Thank you.